Hi everybody and welcome. This is AARC's Big Ideas Theater. I'm your host Ed Hyland, and joining me now is Gary Kaufman. Gary giving a lecture today on patient-centric care. And if you couldn't attend the session, we want to be very specific about the definition for patient-centric care. Go for it, Gary.
Well, there are as many definitions as there are stars in the sky, but the one that we ascribe to is one from the Institute of Medicine, and it's in their document. I'll read from it. Crossing the Quality Chasm, a new health system for the 21st century. And what they posit is this definition: providing care that is respectful of, responsive to the individual patient preferences, their needs, values, and ensuring that the patient values guide all the clinical decision making.
Now, is this something new in healthcare?
You would hope not. You would hope not, Ed. We should have always been focusing on the patient. Indeed, we do. But I think in the last 20 years, we've seen really a migration from the business aspect of patient-centeredness to a absolute patient-centeredness, where the patient is now a partner in the care delivery system, along with the physician, the respiratory therapist, and nurse. Should have always been that way. I think we're getting much better at it.
Well, talk a little bit about, is there a standard model, if you will, or framework to ensure patient-centric care?
There are many models. Again, I think the Picker Institute was founded several decades ago, and specifically their focus is on patient-centeredness. And I'd like to suggest that we look at their 8 principles for patient-centeredness, and this is what they posit. The first is ensuring access to care, continuing and transitioning of care, involvement of family and friends, emotional support, physical comfort, very important, providing information and education at a level that they can understand, coordinating and integrating that care between different providers, and respecting their individual patient preferences.
Does it have to be laid out? It seems so specific, and we kind of casually talked before about how important it is that this be at the forefront of the way we approach our patients.
Yeah, it's a good question. It should come naturally, but what may come naturally to you may be different for me. And as scientists, we prescribe medications, we provide therapy, we do diagnostic testing in a standardized model. And I think the evolution of patient-centeredness is really a marrying of science, empathy, and patient preferences. So it may sound a little bit in a model that one size fits all, but having the ability to address each of those elements really make sure we do the right thing.
Well, how does the respiratory therapist then fit into the patient-centric care model?
Well, I'll use a couple examples. In terms of access to care, the therapist can be the intermediary between the physician, maybe the post-acute provider, to make sure that the patient has an automobile or a bus ticket or an Uber ride in today's world to get to the physician's office. It's one thing to say, for the therapist to say to the individual, and maybe a spouse or child, you have a doctor's appointment next Thursday, 11 o'clock. Will that work? Every patient says, yes. But we need to make sure that they have the ability to get there.
Right.
So going above and beyond in that area. Transitioning, in the last 7-8 years, we've become much more knowledgeable, and I would suggest sensitive, to transitioning the patient, not discharging, but transitioning the patient between the hospital to the post-acute provider. It could be a nursing home, long-term acute care hospital, or home with home health. The therapist plays an integral role with that, along with other care providers, physicians, nurses, social workers. And another area is education. We need to be mindful that the education level of the individual, and simply their reading level, is consistent with the materials that we give them. A lot of patient education materials are designed at the 6th to 8th to 9th grade level, and that may be much higher than that patient can read. So having single syllable words, no semicolons, no commas, no hyphens, is not at the 3rd grade level. So it really gets us to refocus on simple things that we've known all along, but we haven't really put in the model for our patients.
Patient-centric is knowing your patient.
Absolutely.
In a nutshell.
And knowing the patient comes first. We all believe it in here. We need to operationalize it to ensure that the patient is leading the team and is part of the team.
Wise words. Gary Kaufman, thank you so much for joining us.
Yep, my pleasure. Thank you.
This is the Big Ideas Theater, brought to you by Draeger.